If they're foods that get trapped, the foods that stick around, the bacteria are having a party, right? And that's what leads. Snacking is actually not a bad thing. Snacking is good for your overall digestive health. One of the best things to get rid of it is cheese.
Really? Because it'll pull it out?
Bingo.
Okay.
On October 31st, we started eating candy for a week, and now all of a sudden there's cavities. That's not the way the process works.
Welcome to Minty Fresh Takes, presented by ENML, the podcast where we explore the latest trends, science, and personal stories behind oral wellness. I'm your host, Xander, and today we have a jam-packed show covering some of the most important topics in oral care. From celebrities to experts in the field, you're sure to hear dentistry content done in a fun way. So sit back, grab your popcorn and your floss because you'll need it after, and enjoy this conversation. Thanks for listening. All right, welcome back to episode 5. We've got Dr. Jordan Harper in studio with us on set today. We're going to be talking all about your gut health, the foods you're consuming, and how it actually affects your oral hygiene and your oral health and all the good stuff. So we're jumping in right into the first question. Can your diet actually affect your oral health?
100,000%.
Okay.
100,000%. The common buzzword, right? At least I hear people ask me this in public that aren't dentists. It's like, oh, do you see meth mouth? You know?
Yeah.
And it's like, yeah, of course, you see those people that come through and have all their teeth eroded by the acid, but I also see Mountain Dew mouth, right? Where it's like, people are, sipping on sodas all day, right? Which is loaded with two things that are really bad, sugar and carbonation, okay? Bacteria are having a party. The carbonation's acidic, so it's eroding the teeth. So you got double whammy, okay?
Wow.
And so, rampant decay, and I'll ask the patients, what's your diet look like? And like, oh, well, I sip on Dr. Pepper all day, and it's like, oh no, and I'm always a stance of like, look, if your guilty pleasure is having that soda, have it. Yeah. But drink it, finish it in under 30 minutes, and then be drinking water the rest of the day. You don't need to be sipping on stuff all day that has that type of acidity and that type of sugar in it.
Yeah. An immediate response to brushing your teeth, I would assume, would also help with that, correct?
Oh, 100%. Yeah. You don't want to necessarily, so when you take something strongly acidic, so let's say orange juice, sodas, right, things that are carbonated, that type of thing. The studies have shown pH in your mouth stays acidic for about 30 minutes. Okay, so you want to wait about half hour after that acidic thing before you brush your teeth, right? Okay. So no Mountain Dew and then straight to bed, brushing your teeth. And so, and that's just because of that pH. But, the foods that you're eating and consuming have such a huge impact on the microbiome because those foods, if they're foods that get trapped, the foods that stick around, the bacteria are having a party, right? And that's what leads ultimately to cavities and other detriments in your oral health.
Okay. Aside from candy, because we're going to touch on this later in a little bit. Aside from candy, what are some other foods that are not good for the breakdown?
So, that's my favorite. Candy, whatever. That's the number one thing. Yeah. Everyone comes in and says, oh, candy's causing it. No. Yeah. I think the number one thing, and we learned this in dental school, is things like potato chips. Okay. So potato chips are a carbohydrate. What is carbohydrate? Carbohydrate's a fancy word for sugar. That's it. So guess what? The bacteria doesn't care. Yeah. The bacteria sees carbohydrate the same as it sees a piece of candy, right? And the really bad thing about potato chips is they get stuck everywhere. We all know that, right? The goldfish, the kettle cooked potato chips, they're all stuck all in your teeth, right? Yeah. And so so what happens is you get all of those potato chips stuck in the teeth, right? It takes forever to get cleared out if you're not brushing and flossing immediately after. And so what ends up happening, the bacteria just sit there and go to town. So you get people that are chronic snackers, right? Okay. Snacking is actually not a bad thing. Snacking is good for your overall digestive health because it keeps you from having these big meals throughout the day, which are actually bad for you. But it all depends on what you're snacking on, right? If you're snacking on chips and that type of thing throughout the day, that can be really affecting the amount of cavities and caries that you have in your mouth. Fun fact, let's say you're in a pinch, you don't have access to toothpaste, but you've ate chips, you got all sorts of stuff caught in your teeth. Yeah. One of the best things to get rid of it is cheese.
Really? Because it'll pull it out?
Bingo.
Okay.
Cheese, if you sit there and chew on cheese will get as much of that stuff off without the mechanics of a toothbrush as possible. So cheese is actually a good little trick.
Now listen, if you guys are ever watching me and you see me like moving my tongue around my mouth, what I'm doing is as Dr. Harper is talking, I'm thinking about all the chips I've eaten in like the last week, and I'm like, oh my gosh, there's no way they're still there, but just in case they are, like, let me get them out. So that's not something good that I wanted to hear. I'm gonna be honest with you.
Look, I love chips just as much as you.
Yeah.
But, it definitely is. You gotta. Once you go through dental school, you start having second thoughts about everything you're putting in. You're like, oh.
Now, not moving from a bad to a good, what are some great foods that you can eat for your oral health?
Yeah, so I mean, great foods. We already kind of touched on cheese. Cheese has that natural kind of cleansing property, But things that are more pH balance, things that the bacteria that aren't going to love, right? So that includes like your vegetables, right? Lots of your vegetables, right, are going to be great for your teeth, right? Because they're not only going to have like some natural cleansing component to them, but the bacteria aren't going to care about a carrot, It's not up their wheelhouse.
Now, obviously, it's October. Spooky season's coming up. Halloween's right around the corner. Talk to us about candy.
Yeah, so candy, gets typically in dentistry. All the moms come in and they blame little Johnny's cavity on the 12 pieces of chocolate they're eating every hour after they go trick or treating, right? And the reality of that situation is, it's not the case. Now, if little Johnny's been doing that for the last 3 years, okay, sure. But cavities take, as we explained in last episode, cavities form by the bacteria eating the sugar, and the byproduct the bacteria makes as a waste is acidic. Okay. And that's what causes the cavity. Well, that process can take months, right? So it's not a hey, on October 31st we started eating candy for a week and now all of a sudden there's cavities. That's not the way the process works. Demineralization due to tooth decay takes longer than that. But as far as the candy goes, there's definitely candies that are better than others, and there's candies that are worse than others. Anything that's sticky, tacky, caramels, right, milk duds, like all those types of candies that just like really get in there and won't leave. Not as great, right? Because you're just increasing contact time, and that's the whole concept, right, of brushing your teeth is you're trying to eliminate that contact time the food has with the teeth, so that you're eliminating the bacteria food source. If you eliminate that, the bacteria can't, the bacteria are always going to be in your mouth, always, and that's a good thing. But you're eliminating that long duration contact time so that acid secretions are not building up on the tooth. Okay, so not just for the kids and their candy, but for pregnant moms, is there anything they can be avoiding food-wise that would protect the bacteria for their oral health? No, I think with pregnant moms, there's no real restriction or change that's going to really impact the oral cavity. I think it's just using some common sense. If you're having acid reflux, then don't eat tons of acidic foods because it's going to make it worse. Don't eat tons of spicy stuff. It's going to make it worse. Obviously, your OBGYN is going to tell you all the things to avoid because of pass-through, right? Bacteria from your mouth passes through to the fetus. That's going to happen. That transfer occurs. So, your OBGYN is telling you things like sushi and honey and these things that like there's a risk, small risk, but there's a risk of some negative effects being passed along. But as far as specific food groups, I would say no. I think it's just important to make sure you're using a toothpaste like ENML, right? That's going to protect your teeth, decrease inflammation from the gingivitis if you've got pregnancy gingivitis, and just help keep things as minimalized as possible if you've got acid reflux. Hey guys, thanks so much for tuning into another episode of Minty Fresh Takes, presented by ENML. Listen, we all know people that are into the latest trends for their oral care. We also know people on the other side of the spectrum that are not. This show is made for both of those people. And so if you could do us the absolute biggest favor and share this, like, comment, subscribe, but make sure to share this with your friends on both sides of the spectrum and somebody right in the middle, that would be awesome. Our biggest mission here, not only doing this podcast, but with all the products in the dentistry here in Niceville, is to ensure the trust and the quality of product that we continually offer to our patients. Our mission through this show and through our brand new product ENML is to ensure that your teeth are being covered by nutrients that actually benefit your teeth, i.e. microhydroxyapatite. Our toothpaste tablets that we have right here, toothpaste tablets and the luxury mouthwash tablets, these are both available at enml.com. That is ENML.com. And if you're looking for more information on microhydroxyapatite, feel free to check out our latest YouTube videos. Like we said earlier, make sure to subscribe to this channel. You don't want to miss anything that we have coming out. And thanks so much for watching. We'll see you on the next show.